Well, I'm Dr. Susan Young, and I'm a clinical academic working at the Centre for Mental Health at Imperial College London. And I also have an honorary contract where I'm based at Broadmoor Hospital, where I've been appointed as the Director of Forensic R&D in the West London Mental Health Trust. So that sounds like quite a lot, and yes, altogether it's a very busy job. But I haven't always been a psychologist. I have a previous life when I worked as a merchant banker. And that experience in the public sector taught me an awful lot about the difficulties and stresses and pressures that people work under in this busy life that we have today, involving multiple tasks and working at home as a mum as well. So my interest developed, I suppose, as a clinical psychologist in trying to address and meet those needs of people struggling in their everyday life. So I became very experienced in dealing with stress, anxiety, depression, and then also with people with more serious presentations who require more complex treatments. I have a special interest in teaching and training, and I've been running training courses for many years, in particular to help healthcare professionals and allied professionals, as well as students and trainees, to learn cognitive behavioural techniques in providing psychological treatments. I've run these trainings all over the world, actually. I've trained in China, in Japan, in North America, in Singapore, and all over Europe. For 7 years, I set up and developed and ran, leading the MSc course in clinical forensic psychology at the Institute of Psychiatry, and I really have enjoyed seeing these young students develop and grow. They're like my fledgling students, and fly the nest and go off and work within the discipline. My current research has a strong focus on improving patient care, and I do this not only in forensic services by, for example, examining predictors of treatment outcome, but also within prison services. With the latter work, I'm particularly focusing on the needs and diagnosis of people with ADHD and how we can address those in this setting. Of course, with all the research that I do, there comes dissemination, and so I present at international conferences. I'm invited to train internationally, and I've written several books. I'm currently involved in writing another book with a colleague that will focus on CBT treatments for children with attention deficit hyperactivity disorder. This book actually was going to not just focus on treating the child, but also provide techniques and skills for teachers and parents so that they can also work through the book to help and support the child in their everyday life. The other aspect of my work involves consultancy, and I have provided consultancy services for several years in Europe and more broadly in Asia. Nationally, this has involved me being on the guideline development group for the NICE guidelines, which are the guidelines that really direct the practice, the clinical practice that we need to be affecting in the United Kingdom for treating young people with ADHD. Furthermore, I sit on two important advisory boards. One is UCAN, which is the UK Adult ADHD Network, and the second is UCAP, the UK ADHD Partnership. I say that these are important advisory boards because to me these really are absolutely essential, because they've worked together to help people develop services for adults with ADHD, and also to support multi-agencies, to bring practitioners together to think about best practice and current thinking in the management and treatment of children, young people and adults with ADHD. All of this sounds like an awful lot, and sometimes it feels like an awful lot. But for me, the bottom line is about assessing and treating people, thinking this person in front of me has got some difficulties or some problems. Otherwise, they wouldn't be sitting there in front of me. So for me, the question is, how can I help them? What are the skills that I have that can help that individual? What are their needs? And I think I've helped a lot of people in the past, and I'm hoping that I can continue and help a lot of people in the future.